Hey, camp followers! Great to be here. It is 7 a.m. in New Zealand, and Matt Brunke all the way from the US. What time is it with you guys?
Oh, it's only 1:05, but it's still Thursday here, Hannah. What day is it by you?
It's Friday here. So I'm really, really happy to have Matt Brunke come back and spend some time with us, which is awesome because this guy is stupidly busy. And for him to donate his time to camp followers is an absolute blessing. So thank you, Matt. This is great. Today we're going to talk about a few things that you guys have been requesting to know more about. We're going to start off with pulsed electromagnetic field therapy, and then we're going to progress on to shockwave and see where it leads us. So, Matt, let's take it away. Pulsed electromagnetic field therapy. Most people haven't heard about it. Most vets haven't heard about it. I knew nothing about it. So, can you just start giving us a little bit of science behind this?
Sure, Hannah, absolutely. And thanks everybody for taking time to tune in, no matter what time zone you're in or what day this is. I ask myself that question every day. What day is it? What we try to look for with managing arthritis is stuff that's practical. It's stuff that we have some research on. Because you can go on Amazon or wherever else and you can find this will solve it, but there's no actual science behind it. So when I try to find things, especially, and we'll talk about maybe a little later here, is about elbows and some of the new research on elbows, is how do we manage this arthritis? And it's a combination of doing things for the pet, doing things at home, doing things in a vet clinic or vet physio setting that come down to be really important. And electromagnetic field therapy, so PEMF, pulsed electromagnetic field, this was something that was originally developed years ago, but the technology, it was like your grandmother's television. It weighed 500 pounds and required 3 people to move it. Now with the improvement in technology, most of these little field devices are no bigger than my hand, right? So they're easy enough. They're going to be silent. They're not going to be making noise. They're not going to be things where you have to do under anesthesia or sedation. But because they're doing small little waves, and they're creating, most of them are little rings that will create fields of electromagnets. And what the science on these has done is it'll depend on the sound wave of that electromagnet, how that actually is finely tuned. When that happens, on a cellular level, things start to vibrate in harmony. And the things that are out of whack get pushed down to the bottom. So with an electromagnetic field, what we start to do is we start to suppress some of that bad inflammation inside the joint, and we start to have space to have better inflammation. Because we need good inflammation to heal things or to try to slow down the degradation. So electromagnetic fields, well, gee, this should solve it all at once. But because it's a slow fine-tuning thing, it's something we have to do at home, and it's something that's probably going to take a month or so to see an improvement. So with most of PEMF devices, we're aiming for about 15-minute treatments twice a day for 4 to 6 weeks, and then start to taper down as we see some improvement. So we're making very fine adjustments, not making big dramatic changes all at once.
Yeah. Well, tell them what it started off, because I was really lucky. One of the people that we have a good relationship with is David Somerville, and he one of the original PhDs on the bone healing effects of PEMF. So it was originally used to encourage non-union fractures, so bones that are broken, they've been plated, and they just weren't. So the bones were still very much apart, plate was there, everything was perfect. Why is it not healing? So they used it to promote bone healing. And, I think there's a lot of data about that, and pain relieving effects has come secondary to that, hasn't it?
Yeah, it was started, it's a really good point, in the 70s, looking at treatment time for bone growth stimulators. Those treatment times were 4 hours a day, right? So, I mean, that's a half job, right?
Yeah.
So that's a harder one to look at. It was often used for several months in order to get that bone to heal. And remember, bone is the only tissue in the body that can get back to 100% strength. So that's really important. Now, cartilage Ligaments, tendons, muscles, no, we
Yeah.
don't get back that far. But bone, you can. So it would take a long time. So when they start to look at it, they say, well, this kind of works here, works on bone healing. But then we started to be able to change how we heal fractures and how we adjust things. So that didn't become as dominant. They start to look at it again and say, well, where else can we use it? And they start to realize that, gee, this kind of helps in tissue healing.
Yeah.
And they start to figure out the science behind it and suppressing nitric oxide and enhancing nitrous oxide production and reducing other areas. But when they found that out, they said, well, that's great in a petri dish, but does it do anything in reality? So there's a couple of really great studies that have come out recently in the US that have looked at neurological patients. So a lot of them that had hemilaminectomies, and how did those dogs recover in their neurologic recovery as compared to a placebo. And they improved a little bit. And they've also shown that they improve really well, interestingly enough, in their incision healing.
Right.
So how the skin comes together, how the pliability of that tissue comes together, that is something that can be seen really in an immediate period. Because if we think about it with a spinal cord, it's something similar to a bone where we're going to be looking sometimes 6, 9, 12 months down the road for that big improvement. So sometimes these research papers that go out 6 weeks, they say, well, we didn't see neurological improvement. That's understandable because sometimes we have to look longer. And so everybody goes, well, why didn't they just have a year-long study? And I'll go, would you like to fund ours? Because a year-long study versus a 6-week study is a factor of tenfold sometimes in budgeting and keeping track of patients.
I was mentioning that to people last night. So we did a little owner workshop, and I was like, "This is a 12-year study." And, people's faces like, I'm like, 12 years. They were collecting data to give you this fact. Appreciate it, love it, cherish it. It's so important. You're right. Trials are very, very complex and expensive. But so take this back into the owner zone. So I'd love to say that CAM owners always amaze me at how with it they are. We've got a couple here, Lynn and Rosemary. All right. They are very high and understanding level. Bring it back to about OA. So let's give an example. We've got a dog that's got bilateral OA secondary to elbow dysplasia. It's pretty progressed. So we've got some joint restriction. We've got some secondary changes up in the shoulders. So we've got some tendinopathies. We've got the typical dog that we see. Is it the sort of thing that could be relevant to those sort of people? Can we help them?
Absolutely. And that's the thing when we look at some of these, when I look at any of the therapies that are available, remember that placebo effect, literally I could just give you a sugar pill and 30% of the time you'll see an improvement.
Yep.
So those are, when people say, oh, we have improvement, I go, well, what level of improvement? And if you look back at the original carprofen and meloxicam studies, at least in the US, the efficacy was 85%.
Yeah.
So it tells us that out of 100 dogs, 85, completely passing grade, will improve. Yeah. Doesn't mean 100%. So just like all of us, we have to find what works for that individual patient, but we also have to give it the right amount of time. So if the dog has excruciating pain in its elbow, is a PEMF device going to solve it? No. Or if it does, it's going to take it 6 weeks, and we don't want that dog to be in agony for 6 weeks.
Yes.
So we have to taper our treatments appropriate to the level of pain and the level of function that the dog or the cat is showing us. And I say cat because I've used pulse PEMF devices on you name it, different species, because it's something that the owners can do at home. So for the patients that stress out, for the patients that can't come into the clinic as often as I might want them to, for all these other reasons, I can use it. So I hand it out a lot like candy, to be honest.
Yeah. I've used it on my cats and I used it on Holly. Sorry.
Well, and it was funny with the cats. I was talking to one of my colleagues the other day and we said, well, how do we know, right? Because how do we know? So there was actually some studies that I'll mention in a second, but the one that was fun about the cats was because with a PEMF device, we don't hear a click. You don't feel a warmth, right? It's an electromagnetic field. It's not like a giant magnet out of a James Bond movie. that's going to like pull you up and hold you to the wall. So how do we know it's working? Well, with cats, what was interesting was, and I think because animal sense of hearing is probably vastly so much better than ours, one of my colleagues had a device that was out of power. So it was no longer working at all. And she had another one that was still fully charged. And she turned them on and put them in different ends of her living room. And this, I should say that she had been treating her cat in the living room for its arthritis for about a month. And the cat was getting better, moving around. Okay. But she always had to hold the cat on the device. So she was like, well, let me just see if the cat just likes laying with stuff. So she turned on the one that knew that had plenty of power in it, and she put that on one end of the bed on the living room, and at the other end of the living room she put on the old one. And even though it was out of juice, right? And the cat came in, scoped out the room with cat trees and 14 places to lay down and everything else, and walked right over to the brand new device and laid down on that.
That's quite cool. That is quite
so that I think we need to replenish, because we can really, like, there has to be something that these kids hear that we don't appreciate.
Yeah.
Being in tune with that. The nice thing that I do like a lot about the PEMF research is, like I said, we've had stuff kicking around for 40 years. It's looking at it. There was a great paper now on the human side looking at knee arthritis that was done treating them twice a day. They reduced their pain by 44% in less than 24 hours.
See, this is amazing. Okay, so I was hanging out with a human physio recently, and he just poo-pooed everything I was bringing to the table, everything I talked about. And the NHS physios were very much, we need really good science behind this. And we were talking about PEMF, and he was just like, science just isn't chunky enough yet for us to advise it. But, this paper, is it quite a strong paper?
They tracked it out on this one also 6 weeks and showed 60% pain improvement over placebo at 6 weeks.
And how many people were in the study? Was it quite a chunky study?
I don't think it was huge. I'd have to go back and look at the exact numbers. But it was a human rheumatology study. So it's not like it's, human size. They'll get patient load of in the thousands easily. Sometimes or even hundreds. In veterinary medicine, sometimes we're happy with 12 dogs in a study. So obviously we need bigger numbers.
We were talking about that. Yeah, and that, guys, Cam tries to stay evidence-based. The number of animals that are in the study construct will play a role in whether it's a strong paper, whether we can rely on it. And something that was really in conversation in the last couple of days has been people seeing lots of small print at the bottom of products. You see someone's surname, a title, a paper, and a date, and they go, "Well, it's got evidence." Not necessarily. It's
no, and like I've pulled papers like there was a paper on Boswellia for dogs, which we can talk about joint supplements a little later on, and it showed a 71% improvement ratio.
Yeah. That's pretty amazing.
It was an unblinded open study with no placebo, which meant that the scientists knew which dogs were getting the Boswellia. They didn't give them anything else. They didn't give them a placebo, and they knew which dogs were on it. So, of course, there has to be a level of bias. So you have to be able to read a paper for what you're trying to get from it and not just what it's promoting, not the sales or the marketing behind it. Yeah. Now, on the other hand, I'll mention two really good studies I think that everybody, whether you're a veterinarian, a technician, a nurse, a physio, or just a mom and dad with pets, can really appreciate. And to be in the interest of being fair, I will find one British one and I will find one American.
Thank you. Okay, good.
All right. So ladies first. So the British study actually just came out more recently. This one was done in Vet Compass, and they looked at 804 cases of elbow problems in dogs out of over 450,000 dogs in primary veterinary care in the United Kingdom. Okay. And they broke it down for elbow arthritis by breed and the issues. And they finally identified, 76% of these owners were complaining of lameness. 20% can't exercise. 14% can't are having pain. Breeds, right? The Rottweiler, the Labrador, the German Shepherd, 4 to 6-fold increase above mixed breed dogs at risk for elbow problems. Now, on the positive spin, for those of you with Jack Russells and West Highland Whites, your risk of incidence for elbow problems as compared to these guys was much less than the mixed breed dogs.
Yeah.
Okay?
Don't encourage my sister to get another Westie. Okay. Just
no, well, yeah, they're like potato chips. You can't have just one, right? But when we look at that, what are some of the other risk factors? There's a really good study. They said, well, advancing age, so that makes sense. We kind of wear out the joints a little bit. Being neutered. And that's a huge one now too, right? Even in the UK, when are we neutering? And is that changing the growth plates? But also, one of the things that's really important about neuter status is, and I think it's the same in the UK, so pardon me if I'm wrong, but in the US, the back of the bag of food is designed for an animal that has their sexual organs.
Yes, totally.
Right? And so the day that animal is spayed or neutered, their caloric requirements drop by 25 to 33%.
Yep.
So if they were supposed to eat 4 cups a day, they automatically go down to 3 cups a day the day that they're neutered. But if we keep feeding our pets the same, then we increase their risk for obesity. So the Vet Compass paper out of the UK on elbow understandings and just risk factors, not what made them better, right? But just the risk factors involved was hugely important. Now to spin that around to the US study, I'll tell you about 2 ones real quick that are kind of related. There was a 50,000 dog study, okay, not as big as the UK one, okay, that looked at dogs and broke them down by ideal body condition, right? So not fat, not too skinny, just not fat versus fat. And then they looked at those and they said, how long by breed and by sex do they live? Do fat dogs live less? Do fat dogs live more than our normal dogs? Maybe they live the same. Maybe fat's not an issue. Being chunky is an issue. Jack Russells, Chihuahuas, right?
Yeah.
Little dogs, Dachshunds, if they're fat, on average, live 2.5 years less than their lean body weight compatriots.
It's huge. And the thing is, so we were doing an owner workshop last night in Dunedin, and thank you, Crystal, for organising all of these workshops. And that kind of information is just not reaching the public in a language that they can relate to. So the 45 people in the room, you could just see them suddenly realise that chunky fun size is not fun because it has such bad effects on the body. And when you see what world that these owners are exposed to with dogs with arthritis, they're being marketed to with product. And the free of charge is forgotten. Weight control is accessible by everybody. It's an absolute primary foundational need. So thank you for mentioning that.
Oh, and that was one too, because those are huge. Those are not only the simple stuff, but it also goes back, and I'll tie it way back to where you got flack from your colleagues about PEMF.
Yeah.
Okay, because here's why. Okay, fat does a couple of things. Fat literally weighs you down. It's just more mass to have to fight against gravity. But fat also secretes they secrete inflammatory mediators, so things that make joints directly worse.
Yeah.
On a microscopic level,
Yep.
fat eats away cartilage. Okay? Not just that it pulls it down, so it's a macroscopic level, it's a microscopic level.
Yep.
When we do stuff like that, if we don't address, it's a lot of these studies that, it didn't kind of work, or it only worked on some. It's so important with all of these things that we have to get them to an ideal body condition.
Yeah.
Now, they may be bone-on-bone contact, maybe they have less arthritis, but if we don't, sometimes if they don't look at that, if we don't look at addressing the big elephant in the room, we're not going to see improvement. So a lot of these papers that didn't show that great of a result, I always go back and I look at how fat were these dogs in this study.
Yes.
And did they do anything to address the fat? Because if you don't address the fat, you're not going to improve the patient.
Yeah, we did a little campaign, and it was 1 + 1 - 1 = 0. So what does that mean? It means if you're adding something to your therapy plan, so like you're adding meloxicam, or you're adding PEMF, or you're adding stem cells, whatever it might be, -1 is if you don't make the changes that we know are essential, are you going to have the great effect? Are you? We don't know, but you're certainly making it likely not to be as effective as it could be. I'm just going to shunt around because you can't actually see my face now. So back to the PEMF. There's a really good question here because this is important to me. I've got a really big bee in my bonnet about the way that people are marketed to. I know we live in a world where you have to make money. I get it, but people are marketed to in a really brutal manner. And my area of interest with regards to OA management is the owner communication, getting them on board and getting their plan in place. And you just see them go online and they get marketed to with these wild claims. How can we help people look into PEMF safely? What's the sort of thing that they need to be looking for? And I'm happy to talk about the difference between static magnets and our PEMF, because they are very different. People hear magnet and then they think, you know, anything with a magnet in it's going to work.
Right. And so the thing is, even with, not just with PEMF, but with joint supplements or dog food with added things to it, right? If it's added glucosamine, then it's got to be better. You want to see their individual research, not their marketing claim, but where's there's company data that shows that this is worth your investment, that it's going to make your pet better. If they don't have research on it, walk away. If they have research on it, look at that closely and go, well, did you have a, you know, how well was this kind of received? Is there some decent amount of evidence, or is this complete just, you know, fake news? But, you know, those are the things I start to look at now. Static magnets, that's not what we're talking about. When we're talking about with PEMF, you're right. We have to be able to look at these, and you have to look at where it's not that just, oh, well, there's data on PEMF, so all PEMF are created equal. Absolutely not. Okay? Most PEMF is specific to a specific wavelength or megahertz of sound wave, of that electromagnetic wave, that is specific for that research. And that's the same thing. Like, you know, if you try to tune into the radio and you're off by a couple of tenths of a degree, you're not going to hear your favorite song. You're not going to hear the news. So it's not going to work. So when they hand you, I've had companies hand me research and I look at it, I go, this is on a different company's device. And they're like, well, all PEMF is created equal. I'm like, no. And I've had that happen to me on PEMF, and I've had that happen to me on joint supplements.
Yeah.
So it's, you have to ask for the research, you know, and the things you have to be practical on them. Do I think 4 hours is practical? No. There's some other newer devices out now on PEMF that are, you know, half the price of some of the veterinary researched ones. And the thing is with those is that their treatment times are 3 to 5 times what some of the research ones are going to be. So I think 15 minutes twice a day, that's pretty practical. I even like them now because the loops, a lot of these you have to sometimes hold them on there, like with the cats and stuff. Now a lot of these places make electromagnetic field beds so that you can treat, because how many of your pets have just elbow arthritis? Well, heck, even on the study out of Vet Compass, 61% of dogs had both elbows affected. So now if you're going to try to treat both elbows, now you're there 30 minutes. So a lot of the beds now can treat their LS, their hip dysplasia, their bad knees, their bad elbows, all in one treatment time. So it's a larger field. So that makes a lot more sense.
I'm happy for us to mention names. So just anybody new to CAM, we try to have bias. We try to be really independent. We would love the money of sponsored posts, but we don't actually take it. But in this kind of situation, I think it's really quite important to give people a little bit of a guidance of where to go, because I know after this, and if I was back in the zone with Holly, I would just go online and try and buy something. So over in the UK, we use a company called Westfield, and they're fantastic. They are very ethical. They provide CPD on the topic, so they provide continual education. They are very, very helpful, and their product is very cost effective. So over here in the UK, not here, in the UK, Westville. And for you guys, what would you be using over in the US?
Most of the ones that I've had good experience with has been the Assisi products.
Yeah.
So those are the ones where I've got the data on. It's not that I work with those types of things because when I've read the data, that's enough where I could start to see it. And then, to be honest, what I always do with almost every product that I can is I have arthritis. So I'll go aggravate it. I go for a run. I'll go aggravate it. And then, I'll go try it on myself and see if it improves me. So I've done that with a bunch of different products. And when it doesn't improve me, then, well, maybe it'll work on my patients. But if it works on me, now it's a little bit more that I can then go try it on somebody else.
I love the fact that you experimented. I shockwave.
Oh, I totally experimented myself.
I shockwaved my toe the other day. It was just like, oh, bloody hell.
Yeah, well, that's a good transition. Let's talk about shockwaves.
Yes, it's a perfect transition. And I tell you what, though, really interesting. In the research, it says that very shortly into your sets of pulses, so 850 pulses, 360 per minute, etc., it becomes tolerable. So initially, it starts off pretty painful. Totally did. Like when we first put the Trode onto my toe, I could have punched Andy in the face. But literally within about 200 pulses, I was like, "That's all right. I'm totally with this," because of the release of the inflammatory mediators and that peripheral kind of desensitization. I was like, "Yeah, I'm hard as nails. I can cope with this." But yes, we do experiment.
And that's when you go in for the massage therapy and the woman stands on top of you and just walks all over you. Like the first couple of seconds, you're like, "Oh," and then you're like, "Oh, this feels really good."
Yes.
I think that's individual variant. I think that there's probably a bunch of people that would be totally freaked out by that, and that may not work. So I think we have to tailor it, especially to our nonverbal patients.
Yes.
Shockwave was used a lot in horses, still used a ton in horses, now transitioning more to with dogs and cats and other species. Again, little tiny sound waves to get into a joint to start to calm that joint down by helping that joint make things that it wasn't making before. So kind of resetting the table a bit. A lot of these, in order to make these sound waves, we kind of think of a jet going supersonic. Yeah, you can get these really big, loud noises. So when I first started working with this, you'd have to wear big, giant ear protection, and most animals would have to be heavily sedated because they probably had a similar reaction like you did, Hannah. It was like, wait a minute, what's going on?
Yes.
And I think that that's still a good, viable, helpful product. It's one of the ones that's been around for a while, so we have a little more research on it. One of the ones now that I've started to look at, and again, as technology always improves, can we make it a little bit simpler? Can we make it a little bit better? There's a Shockwave system out now that I've used for a couple of years now that I've treated every patient awake. And instead of a Gatling gun going off with sound protection, this one sounds more like those gas burner stoves when you first get them to self-light. You have to turn them and go tick, 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 tick.
Yeah.
And so the helpful part with that is I can do those awake, and then I can ramp up the intensity to the tolerance of the patient. And you go, wait a second, how do you know the tolerance of the patient? My nurses are watching them, and you can actually get it when the dog just kind of twicks around.
Yeah.
Or you can dial it in and have a little more control and a little more fine tuning. The helpful thing about Shockwave is it's probably a little bit more potent than PEMF. So with the older Shockwave machines, we were treating them the first of the month, 3 weeks later, and then maybe 3 weeks after that, because we kind of had to deliver a lot to them. Now with some of the different Shockwave systems out there, we may only have to treat a little more often, so maybe 2 or 3 times a week. But we're able to then taper that down after a couple of weeks, and we're able to treat those all awake. So it's a little bit easier sometimes on our geriatrics. Yeah. Now with any Shockwave, it has to be done in the vet clinic.
Yes.
Unless you have a mobile vet coming to you.
Yeah, we've made quite a big jump there. So PEMF, which is not static magnets, they're not these kind of, we're talking about the magnetic collars, we're talking about a completely different thing. It just happens to have magnet in the title. PEMF is available for therapists to bring to your house. It's available for you to purchase and administer yourself, and it's available in some clinics. And it's something that's in the background, and you use it as maintenance quite often in a lot of these cases. Whereas Shockwave is much more interventional and definitely only done by vets, for small animal anyway. And there's a wide variation of products out there. So the electrohydraulic, piezoelectric, and electromagnetic, I think it is. And different price points. So we've got the PulseVet one, which is electrohydraulic. Yeah. And it's loud. It's really loud. And we have to sedate. And we are just beginning to introduce it into our offerings. And we're doing, say, elbows or lumbosacral. The data is saying, I think 3 occasions around about 1 to 2 weeks apart is what a lot of people are working on. Is that right? I know Alan is going to be joining us soon from the University of Cambridge, where they're doing quite a lot of work on Shockwave. So that's exciting. But that is very much in the practice. The price point is probably about 300 plus 50, 100 for every other area treated plus sedation. So you're looking at quite an outlay. So in the UK, if you were taking your dog to a practice that was doing it, it could be a 700 quid package. And then it's repeated. So you can't be guaranteed that it's going to work just on one occasion. What are you doing over where you are?
Well, and I'll follow up on that. I will tell you that 95% of the time, a lot of these therapies, you're not going to see improvement off of one thing, whether that's one rehab session, one shockwave, obviously one PEMF treatment. You have to commit to a time frame and understand how this modality, this pain relieving modality that works probably about 85% of the time, right, is going to take over a period of time to see improvement. So there has to be a commitment on what's practical and what's feasible, but also that you can't just give up on it after a week. The only thing out there, let's say for elbows, that's going to magically cure an elbow, I can cure an elbow. I'll have to send them either to Michigan State's vet school, or I think other than Knoll, there might be one other 2 practices in the UK that are doing elbow replacements.
I would not take that lightly.
Now, here's the thing, with all due respect to the surgeons will only do elbow replacement when we have exhausted all of the other. I've talked with the head of Michigan State's vet school's rehab department, as a friend and colleague of mine. And I was talking with her just last month, and I said, all right, what are the surgeon's rules on elbow replacements? And they're like, you have to exhaust everything else before we get to it, because it's a major undertaking.
Yeah, there was one paper out that said something like 29% or something like that had satisfactory results. And you're like sitting there.
It's still, I think, in the right hands with the right case, and with the right parents on board, you have to line up a lot of things, and it's not something to be jumped into lightly.
No,
for sure. I hope that it continues to get somewhere really good, but surgery, we think about surgery as an immediate gratification. It may make the whole situation better, but it still may take 8 or 12 weeks for everything to heal to let your pup run around. So things like PEMF and Shockwave maybe take a little longer to undo the years of arthritis, and we still have to undo the chubbiness, and then we have to build the muscles stronger. So this is always a time commitment as well.
Stop them jumping in and out of the back of the car.
Simple stuff, go for a walk, stop jumping, stop playing fetch, go for a walk every day.
Yeah.
Daily low impact exercise, burn off some calories. All those things all help. So I think it's always understanding what are our expectations of how quickly can we get this better.
Yeah, no, and I'm not going to go hippy whippy here, but surely the real holistic approach, so that terminology I feel has been totally abused by people that are selling things. Truly holistic approach is looking at the whole picture. So the owner, the dog, and the environment. And, there's no point you buying some herbal powder or something that says holistic and thinking the problem solved. No, you've got to change your lifestyle. You've got to get the dog's weight down. You've got to get the right kind of exercise management plan. does
Well,
frustrate me.
but, and who looks up, right after Christmas, New Year's Day, everybody's in the gym no matter what country it is, right?
Yes.
But who's still in the gym February 1st?
So true.
Who is not committed, who's gained back, I gained all this holiday weight, I'm going to lose it, I'm going to juice cleanse and crash diet and do this. And then 60 days later, they're right back at their original problem.
Yeah.
So arthritis is a lifestyle change. You absolutely nailed it, Hannah. It's got to be this commitment to getting this managed and making it as least of a problem as possible.
Yeah. And I think that's something that I'm just going to go tangent.
Yep.
Almost when you have these cases diagnosed, you need some kind of life coach and counsellor step in, because the key person here is the owner, who has to accept it, embrace it, and adapt. And when we do our little owner workshops, we talk about rebuild both physically and the relationship, because the relationship is going to change. So it would be like what happened with me and Holly. We would hike, we would mountain bike, we would run, we would, do so much paddleboarding, and she'd be running up and down the beaches and stuff. It had to change. I had to stop doing it, and I had to adjust. And that was hard. It was really hard.
Yep.
So that's what we did. That was us. And I just don't feel that there's enough support there for owners, because what happens in my mind is that they fall back into old ways, and the dogs, because dogs are nicer than people, cope, and they'll get on, they'll go for that 5-mile walk because they love their owner and that's what they do. And the owner will go, well, it's not a bigger problem then, so it must be okay. He's obviously better. And before you know it, you're back into your old ways. There needs to be some life coaching, some kind of course that owners can go on to cement this kind of understanding.
And sometimes it's just that they have to reach a point where they finally accept that. I did primary care veterinary medicine for first couple of years out from school. I totally relate to my colleagues that still do it. It's especially when you're on a busy clinic day and you've got 3 walk-in emergencies, it's harder to have that conversation with the owner about how fat their Labrador is. And sometimes it's a harder one, especially for new grads, to be comfortable to go, your dog's fat. I can look at it now and go, your dog's fat, and we have to improve that. This is why it's bad.
Yeah.
But that comes a little bit with time. But if we set those types of things up, I think we can be really successful. Yeah. And the life coaches now, I think, are our rehab therapists, our rehab nurses that I see my patients regularly, but my nurses will see them once or twice a week for 2 to 4 months.
Yeah.
Right. So they're really in tune with, and this way it kind of allows the owner to say, oh yeah, we're on board. And a couple of weeks later they slack off, and my nurses will catch them and they'll be like, so you slacked off, and you're like, oh yeah, let me get back on that bandwagon again. So that consistency of having that coach is really the physios and the rehab nurses, I think. Those I think are the keys as they go around here into getting that consistent message, because that also allows, I think for the veterinarians, it also allows us to have such a great mediator for us, because sometimes owners are intimidated by us, or they forget to ask something later on and whatever. So I always tell owners, if you ask Kirsty, she'll get the answer, and if she doesn't know it, she'll come find me. So you're not bothering us. We want to help things succeed. So I think having those recommendations is key.
There is a massive need for this multidisciplinary team on many levels, not just people that are interventional and hands-on on the dog. There's the communicators. So really quick tangent, receptionists, nurses, your role in this is huge, because Mrs. Smith, who comes in and stands around a reception desk, you can influence her. It's so important. You can influence weight loss. You can influence lifestyle change. And you can start teaching them to be a bit more objective with their monitoring, so that they bring us the goods that we need to know if something's working or not. We could talk about this for hours, because this is the thing that I kind of love, because what I find quite exciting is there is lots of treatment options out there. I don't feel that they're getting directly to the owner in the right way, but it's also getting the people on board to employ them and use them appropriately. We've done PEMF, and people know that is something that they can access clinic, therapist, and potentially purchase. In the UK, insurance companies will pay for them. So you can actually buy your own unit, which is quite interesting. We've spent a little bit of time with Shockwave. It's really quite new in the UK. There's not many places doing it, but we've got Professor Allen from the University of Cambridge joining us, I think, later this month. And he's going to be talking about the studies that they're doing there, which is really exciting, really exciting. Let's now go into another area. How long have we got? We've got 15. What do you want to talk about?
I want to go back to an older one on therapies, but some with new research.
Yeah.
Last year or so, there was a paper that came out, the Canadian Veterinary Journal, and I love the Canadians, right? They're wonderful people.
Are you trying
but
to?
They also, there are times I consider it, that all their journals are open access, which means that any veterinarian, you don't have to have a subscription to a specific journal. You can get this by going on there and lurking. It was so it's laser therapy, so photobiomodulation, and it was Dr. Jan Huntingford and Dr. Andrea Looney. And Jan's wonderful. She's up in Ontario, and Dr. Looney's over in Boston. And both of them, I'm lucky that I consider them both colleagues, and lucky or automatically colleagues. But the fact that they're both friends and good friends of mine that I can reach out to, they went back and said, laser therapy probably needs to amp. We were really delicate in our dosing. We didn't want to do any harm. Yeah. And I think 15 years ago, that was completely valid. Laser therapy 15 years ago is probably where we are with Shockwave now. We're just learning where to go with Shockwave and how to get a little bit better. Laser therapy 15, 20 years ago, we think this works, but let's go low and not harm anything. And now we've started to realize that we can go up. So what they did was they looked at dogs with elbow arthritis in both Canada and the US. And instead of the typical doses of about 8 to 10 joules per centimeter squared for elbows, they brought it all the way up to 20 joules per centimeter squared. Whoa. They doubled it.
Okay.
Right? First, no dogs dropped from the study from side effects from too much laser.
Okay.
So none of the dogs were hurt by it, first and foremost. And they had safely already proven in other ways that this was going to be an acceptable dose.
Yeah.
Right? Because the human studies are now going up to these doses.
Right.
So they said, okay, so let's be careful with this. They did it very, very carefully, very well organized. And they said, all right, let's go up. And if we go up in this dose, do we get the same effects as we get with the lower dose? No, we actually got better effects than we did with the lower dose. So higher dose was not only safe in that it didn't cause harm, didn't burn them, didn't do anything like that, but also got better outcomes as compared to older papers on lower dosages.
Right. Right.
So now when I look at
just
elbows,
explain to them what you mean about 20, because I think
UK,
there is a lot of people doing laser, and I'm going to be outrageous. It's very easy to purchase a laser. It's very easy to have one in a clinic, and it's very easy to use it a little bit like a wavy wandy. And if you're not actually using it in the area that you're targeting, you could question its
Yeah. Again, and with laser, with all of these therapies, we really have to know what we're dealing with. Okay? We can't treat this without getting x-rays. We can't, because things like laser and certain types of other devices can be, if they make good inflammation happen to make tissue start to feel better, they can also make things like cancer get worse because it'll feed cancer. So we always have to know what we're dealing with. The one exception to that is with 99% certainty is PEMF. I actually use a lot of PEMF in my cancer patients because the studies so far have shown it to not be contraindicated with cancer.
Okay.
As far as we know it. So that's a huge step. But to get back to lasers, I'm not going to blind everybody, but here's my laser pointer that I use when I speak, right?
Yeah.
So this little laser pointer is going to put out a dose of laser wattage of about, a whole whopping 1 milliwatt. And it's a tiny little amount.
Milliwatt.
Right. The laser scanner at your quick check is about 50 milliwatt. Okay. when we talk about laser therapy, we're talking about a machine that's going to put out 1 to 15 watts, so a lot more powerful, right?
Yeah.
We've gone from the lasers you look at really have to determine, like, I could treat my own elbow or my shoulder with this laser. Okay, I've done the math.
Yeah.
It would take me about 6 months of continuously having this laser on my elbow or my shoulder in order for me to deliver enough energy to make the joint feel better.
Wow. That's good maths. I'm going to use that if that's okay.
Right. Please do. Right? So with these different powered lasers, it's treatment time. It's what's effective to get into the clinic. But if you have a little low, like there was a paper that came out a couple of years ago out of Michigan State that looked at incision healing, and they found that lasers were useless. The hard part was it was the same wattage output as a scanner from a quick check.
Right.
So we had to, now that paper is being redone. So when we talk about laser dosages, it's just like you can't just take one antibiotic, right?
No.
If your doctor says you have to take 2 antibiotics twice a day, it's because you need to build up those levels in your system. If you take one once a day on your antibiotic, you're not going to kill the bacteria.
No.
You're actually going to get resistance. You're not doing any help. You're only doing harm in a way.
And I think this is a really good topic for pet owners to understand, is that there's loads of data coming out from all over the world about different things. And some of the data is good and well constructed and thought through using up-to-date techniques. And other data is poorly designed studies, inappropriate products, a little bit out of date really, but they're going into this pool and really influencing people's understanding. And there's it like PRP. I think that the studies that are coming out of that, because there's such a variety of PRPs out there now, some of them are shocking, and the results they're getting, oh crap. And then people are assuming that that is just a no-go option, whereas actually, if you're putting an appropriate product in, the results are pretty good. What do you think about that?
I think you're absolutely right. We have to look at these with a critical grain of salt and not just take it at face value. You have to look and see which ones are doing it, which ones are repetitive doing it. I joke around all the time that you could make a career, any good scientist could make a career of literally repeating everybody else's research and seeing if you get the same. You don't have to have a creative mind to be like, well, I have to come up with a new study on a new thing. No. A lot of times go back and repeat another study that somebody else did and see if you get the same outcomes.
Yeah.
Right?
Yeah.
Because especially in vet med, we have such few studies. So if somebody go back and just do them again, do we get the same outcomes again?
Yeah.
So
and I think that's something I didn't realize. Like when I qualified as a vet, I really I used what I learned. I used what I was taught. Mm-hmm. I don't think I was really aware of the studies that created the data that I was being taught. And then it's only later in my vet career that I started to be more critical. I'm like, oh my God. So I do that just because of one study with 10 dogs in it? Crikey. Mm-hmm. And it is really true. So there is a little bit of, a lot of art compared to science.
It is, but it's also hard. Like I give all the credit in the world to the general practitioners because they have to be orthopedists, nutritionists, cardiologists, immunologists, protect every aspect in primary care. So I snuck away. I became a specialist and I focus on certain areas. And like my girlfriend will give me, she's like, well, why don't you remember this? I'm like, I haven't used that in 7 years. I mean, it exists somewhere back here, but I haven't used it.
Yeah.
So it's just like the Spanish we took in grade school. If we don't keep up with it, it's not there. So to keep up with all these new things, to learn what we learn in vet school, and then to keep up even more as more and more research is coming out, it's hard.
It is really hard.
And I think that's where trying to squeeze in a journal or a podcast when you're on the treadmill or you're trying to do something a little bit for yourself is just as important. So we're all still there as a team. And then when you get good conferences together, like you mentioned Professor Allen, I am so looking forward to his lecture in Cambridge because he's speaking at the International Rehab Meeting later this year. I will be in England for that. I'm so looking forward to Professor Allen's talks.
Yeah,
because I'm like, wait a minute, like I want to go and listen and learn from like that's Matt Allen. Holy cow. So
Yeah.
it's going to be a good time, but we all have to keep learning. We have to keep trying to understand what we can and how to best be practical in applying it.
Yeah. I totally agree. And so owners, that little kind of detour that we've had is, I really think it's important that you guys understand this is a developing field. There's a lot going on. And we're doing the best that we can to try and get you reliable interventions that you can fit into a management plan. So at the little owner workshop yesterday, I promised everybody that they'd go home with something that they could do. So no matter what financial income they had, what physical capabilities they had, what dog, what breed, what degree of arthritis, we can, using the multimodal concept, influence every animal in a positive manner. And a lot of the foundational changes are the free of charge stuff, the exercise, the weight control, etc., the lifestyle changes. But there are more and more things that we're adding, and it's about asking about them. So I'm hoping that Cam will highlight that there are things there that you can do and stop you seeing stuff online with ridiculous claims that are crazy. So I'm just going to give a little kind of Cam warning here. We've seen that a lot of supplement companies are following our algorithms. So a lot of the Cam followers are now being targeted on social media quite heavily by very new, very unheard of supplement companies. And we've actually even seen some of our text. So our social media film called In Silence, Suffer in Silence, is now featuring on a major ad campaign for an unheard of supplement. So please be careful. Speak to your vet, speak to your rehab therapist. Do put some groundwork in with people that are really interested in this area, because there are a lot of stuff. Another little kind of thing that I want to say is we're fixated on what we give orally. There is this real focus. It's all about what goes via, be it the medication and be it the supplements. And what Cam really tries to highlight is that there's other ways that we can manage this disease. So please be aware of that as well. Anything else before we kind of go our separate ways and you come back again?
I think you nailed it. The key is it's got to be that team approach.
Yeah.
It's not only multimodal in between supplements and pharmaceuticals and joint injections or other things like that, but it's also between the nurses and the vets and the owners and what we're trying to accomplish. We get to stuff like that, we can get good success, but we have to look and see what research do we have and how to think critically about that. With Nutriceuticals, which we could talk hours on that one, because again, there's no federal oversight in the US. I think in the UK as well. Like if I wanted to pay off my student loans, I could grind up shredded paper and put my smiling face on a bottle and sell it on Amazon as a joint supplement. And it wouldn't be ethical, but it would not be illegal. It would actually be legal.
People have said we should do it. And I'm like,
But so there's all the things that are out there. You have to really look and to see and to try to think, where are they trying to get me? Are they trying to get me to buy something? Are they trying to get me to do something? What can actually I do? Who do I trust? It's got to be the people that keep educating and keep an unbiased opinion. And that's the medical professionals. Human side, veterinary side, physio teams, everybody's out there that we're there to try and get this accomplished and to realize that arthritis has been years in the making in your pet. So it's not going to be undone overnight. It's going to be that lifestyle change, but it's also going to be committing to it that even if you want to inject $4,000 worth of stem cells or do a $6,000 or $8,000 joint replacement surgery, you still have to commit to keeping them lean and keeping them active and doing things. Otherwise, we're going to have failures and we're going to have not succeed.
Right back at the beginning, you said bone is the only tissue in the body that can get back to 100% strength. Just tell them about tendons, because I think people really don't realize that, you had an injury, you're not all clear. You've still
right. So tendons and ligaments, let's look at skin. Your skin incision heals in about 2 weeks, right? That's why your skin sutures come out after your cat gets spayed or neutered, if they're leaving in skin stitches, right? But that skin only reaches about 73% healing at a year. Tendons, 83% healing at 6 months to a year. It never reaches 100%. Ligaments, not all ligaments are created equal. Certain ligaments have about a 70 to 80% healing potential. The dog's cranial cruciate ligament, the ACL in a dog, only has a 40% healing potential. So you really have to think about how are these going to heal and in what time frame. That's going to be the key.
Yeah.
It's setting it up for what it's not going to be healed. It may be strong enough to do it. And if it's strong enough just to go for the walks and be active, that's great. But if you think that you're going to be able to stress it back out and put it through another 3 years of fly ball, that may not happen. It's going to depend. And I'm not picking on fly ball specifically, but just as an example of what our goals are trying to achieve. That's the lifestyle change.
That's so interesting because there's some people from agility groups. Agility is massive in New Zealand. And I was absolutely petrified talking about what I was talking about. And I was like, okay, here we go. And we're really, really receptive to the fact that, we're not saying don't do it, but you really do need to be getting these dogs health checked on a regular basis. So pre-season, post-season, any form of injury, get it checked, because I'm a border collie lover, as you all know, and those dogs will go through hell and back to be with you and to do what they do. So do, understand that they're still made of tissue, and tissue isn't infallible. What a lovely question here. To do 10 top tips. Front feet. Now, this is something that really I've got a little bit of bee in my bonnet, because there's not much out there about digital OA. You look in any of the textbooks, it's always a tiny little paragraph, reams and reams on elbows, reams. But come to digital OA and it's just like, oh yeah, shit happened, and we can cut the joint out if it's really severe. And you're like, what kind of shit? What kind of stuff do you do?
Digits are important. They are so important, because especially on border collies, right?
Yes.
Herding dogs, because remember that our back legs are our propulsion and our front legs are our turning and our braking in dogs. So these dogs, especially the herding dogs or the agility dogs that constantly jam their toes, right? They walk away with all this OA. The elbows may be fine. The shoulders, maybe some minor secondary stuff, but it's the toes. Now, if that's the thing, well, do we need to just chop off the toes? No. Do we need to do toe replacement? No. Okay. But it may not be the dog that has to take meloxicam every day, right? But that's the dog that we need to keep really well trimmed in its nails so that it balances his foot, just like a horse gets a farrier on a regular basis and gets trimmed. And I keep those dogs lean. There's not a lot of muscle, so you can't massage it a lot. But things like PEMF, because it works really well superficially, can help. I'll inject those joints, the little toe joints, with either a little bit of cortisone or PRP as a targeted relief. And I make sure those dogs have a chance to warm up and stretch, that they can really kind of work a little bit. And then I'm cognizant of what I'm going to try to do with them. If they really have a lot of toe OA, they can probably run in a straight line really well. They'll be able to walk pretty well. But if I'm asking them to really stop hard, stop frequently, turn frequently, it's going to make it worse. So if that's the case, then I want to stabilize the shoulder muscles and what we call the thoracic girdle, right? The shoulders, the lats, everything else in here, to try to balance them a little, because that's where we can actually build some bulk to help protect them when those toes then bother them.
Yeah. I've had a problem with my toe, like everybody knows, and I've had it strapped for about 3 months. I've bought special shoes called Hoka trainers so that I don't put so much pressure, and I'm slowly beginning to start running again. And it is sore. Like, it's better now, but when I think I got a tarsal plate tear, oh my God, really sore. The idea of someone, like, I went to the gym and I was like, am I willing to do like jump squats and stuff? No, I am not. It's really sore. Some things that I do is I like them to do Kong feeding, because I find that they end up flexing and extending of their own follicle. So they keep those joints moving. I love hydrotherapy because taking the weight off
Mm-hmm.
digits and getting them through warm water is a really lovely thing to do. We had Diane Messam from the UK on here, and
Oh, it does. Yep.
she uses some orthotic supports. So she has booties that she slowly gets them used to.
Yep.
They have less concussional forces going through them and more support. There are things out there, Patricia. I hope we can help you find them.
And with that, Di is giving a wonderful course, and I've already enrolled at the rehab conference in August. She's doing a whole course on prosthetics and orthotics and what she does with her brain. So I'm going to be front row center. I already told her that one.
I know, I'm so gutted because we're the guys, the camp team are doing the big walk. That's the only week we can get together. We're doing a walk across Scotland over 5 days and camping rough.
That's not bad either.
I know, but hopefully I will come down to Cambridge and see you at some point. So let's do these 10 top tips, okay? We do this on every single one. I'm going to start with 10. You're going to start with 9. So number 10, I'm going to steal it. Weight loss. Weight loss. It is absolutely imperative.
Ooh. Daily walks.
Yeah.
Absolutely. 60 minutes a day, whether you have a dog or not.
Yeah. Think about lifestyle changes. You know, I said last night, how many times your dog jumps in and out of your ute? They say a ute out here. It's not a truck. Ute. If they don't need to be having 6 times their body weight go through their front limbs on a regular basis, don't do it. You know, so think about lifestyle changes because they have a massive impact. Number 7.
Yep. Joint supplements are going to take 60 to 90 days to see improvement.
Nice.
On all the research. And since you're there, you have to talk to them, right? Because green lip mussels, right, are one of the best ones, but they have to be freeze dried and appropriately prepared. You can't just grind up the shells and throw them in. Okay. But 60 to 90 days for joint supplements to start to see improvement.
Where are we at? Number 7. That's a real cool one. For me, interactive feeding. I think that it's absolutely fantastic for both the owner and the dog. Distraction, movement, eking out their feeding time throughout the day. Feed them less, keep the brain busy.
For sure. And to go along with that one is just knowing like what you're feeding. Like sit down with your veterinarian, or like they'll even do teleconferences now with veterinary nutritionists and plan out that you're feeding appropriately.
Nice, like that. For me, oh my goodness, let me think about this. Add a therapy. So I started the CAM journey because I learned to massage and I just saw such massive benefits from it. And it opened my eyes to the fact that there's more than drugs and supplements. There's way more. So go and speak to your vet and ask them who they recommend and understand what that therapy is supposed to be doing. So understand what it's going to do for you so you can have expectations. And if you're not hitting those expectations, ain't working for you, don't spend the money, do something else.
Know what you're getting. Okay? Don't know, if you're going to go out and get a Bernese Mountain Dog, be prepared for, at least in the US, elbow dysplasia, hip dysplasia, and other issues. So in all of the seriousness, know what you're getting when you get into certain, not that all breeds are wonderful. Absolutely. And there's a lot of healthy breed lines, but know what you're getting. Know what you might be getting into and be smart about it. Plan for the 15 years that your pet's going to be around with you. Yeah,
I totally agree. One that's always close to my heart is let's talk about this. So if you are being influenced by arthritis, if you have a dog that has it, if you've lost a dog that had it, what I'm finding doing these owner workshops in and around the place is people just don't know about it and they really don't understand the serious nature of this disease. The main clinical sign is pain and it's the leading cause that we put dogs electively to sleep. So how are we going to change it? We're only going to change it if we talk about it and make it a topic of conversation so people can pick up on the signs earlier and then they have more treatment options available to them. So please, Your Dog More Years. It's a hashtag that we try and get everybody to use so that people can access reliable information. Number 1.
Oh, go see a rehab specialist. Go see them. Okay, come see us. Because even you're like, oh, I can't, it's too far for me to travel there once a week or every other week. come in, because we can start to pick out where the exact problem is, give you a bunch of homework to work on, give you some goals. And I like to see all my OA patients at least every 6 months, if not every 3 to 4.
Yeah.
So get out where we can kind of see and touch base, because if we can be proactive instead of reactive, then we have a little bit of a better chance of holding this all together.
Yeah, absolutely. And that's something that we were talking about a lot last night, is that for some reason OA is just the bolted horse disease. You know, they close the stable door, and we've missed chances all the time, because dogs are more beautiful than people, and they accommodate pain to a degree that I just don't think we really take, give them credit for. But thank you, Matt. Brilliant live.
My pleasure, Hannah.
So Matt will be coming back later this year. You have to all say a massive thank you to him, because he's an absolute megastar for giving up his time for us.
My pleasure, dear. Thanks, everybody.
We will see you. I'm going to come and find you in Cambridge to say hi and buy you a beer.
Looking forward to it.
Cool.
Have a good day, everybody.
See you later.
Bye.